Hi, Micheline.
Hi, good
So we're,
morning.
we're, we're here to talk to you after giving you your Daisy Award this morning. Were you surprised?
I wasn't expecting this.
Why were you not expecting it?
Um, it was just a surprise.
Yeah. Well, it sounds like you're incredibly deserving of it
Thank you.
from what we read. The patient who wrote about you talked about how comforted they felt by you and how safe you made them feel while they were in the hospital. And I think that's a pretty unique skill. So, why do you think that patient felt that way with you? And how do you do that? Like, how do you, in the course of your day, in the course of your work, um, affect people that way?
Um, when I come in the morning, while I'm doing my boards, I usually ask the patient, "How can I make you feel comfortable? How can I help your stay be better?" And usually they'll tell me.
What kind
And
of things do they tell you when you say that?
usually simple things like have my doctor come in and talk to me, or have my doctor call my family, or can you charge my phone?
Mm-hmm.
Um, or can you tell me my lab result from yesterday, or what's the plan? And I think communicating with the patients, especially on their level
Right.
sometimes, makes them feel comfortable. And also,
That's a wonderful question to ask somebody.
yeah,
It really
keep them
is.
comfortable.
Hmm. So you do that every time you come in. You say that with all your patients.
Usually every morning,
How long have you worked here with us here at Jefferson?
the last 8 years,
And have you always worked in acute care?
yes.
What's what's your what's your favorite part about what you do as a nurse here?
My favorite part is always waking up, coming to work, seeing that I made a patient feel comfortable, especially when they get discharged and they're doing well. Um, that makes me feel proud, like I made a change.
Hmm.
If a patient's going downhill, of course that affects me, it hurts me, but usually my patients usually have a good turnover, like a
They
good.
do. What do you think? What's been the hardest part for you in these 8 years professionally?
The hardest part it was around COVID when we wasn't ready for what happened.
Yeah.
Everything just happened so quick. Um, that was the hardest.
What was hard about it for you personally, professionally here?
Um, that it happened so quick. We wasn't ready. We wasn't sure what was going on.
Yeah, the uncertainty of
Um,
it.
and we probably didn't have enough hands on during the time, like to get everything
Hmm.
done quickly. We didn't have enough equipment, but we tried our best. We rented equipment from other facilities, and
Hmm.
so we made it happen.
Yeah. How do you think you got through that?
My team, the team I'm with for East Frankfurt is pretty good. We work together. My manager, um, the supervisor over there,
Hmm.
everybody was hands on, and the educators, everybody would just jump in.
People came together.
Everybody came
Yeah.
together.
Yeah. Well, it sounds like you were a big part of that. If you could give advice to nursing students or people just starting as nurses, because I think it's different for us when we first start versus once we're in a little bit. What would you tell them coming into acute care nursing right now to be
Um,
successful, to be as successful as you are?
I would say it's never easy in the beginning. A lot of people think nursing, wow, it's simple, just giving out meds or just coming in and doing what they have to do and leave. I feel like you have to have a connection sometimes with your patients, and having a good team makes it
Hmm.
really helpful as well. Um, Definitely being strong and not just a lot of people think staffing affects them, but people come and go. So having a good team makes it perfect where you just work together and make it better. Like as a small unit, keep it together and make it better.
What would you say makes a good team member? Like, what's a good quality to have as a member of a team, from your
Um,
perspective?
Someone, I would say, coming in, a lot of people come in with like a bright attitude and a team member that would just be like, hey, I walked 35 to the bathroom, where they didn't have to come to the break room and get you and be like, hey, I just walked her. Like somebody that would just come in and do what they have to do, and like we just do it together, like we work together. That's like a major part. Just working together, I think, is like the major part of this.
Yeah, I think you're right. I think coming in, you know, the work is hard, right? We know that it is. It's just the nature of it. But when you come in with a mindset like you do, that you can do good and make a difference and feel good about it, that changes. That can change the whole course of your day and the whole course of your team.
Yeah,
because your team loves you too, and they were very verbal about that.
Thank you.
And I think that's clearly because you bring all those great attributes that you're describing to your team as well.
Thank you.
I'll ask you one more question.
Okay.
You talked about, you know, coming in and asking the patients, you know, what's going to make you comfortable today? What can I do for you today? How do you connect with all the different kind of people you have to connect with, right? Because we deal with a million kinds of people, and for all of us, some people are easy to deal with and some people are harder to deal with. You know, how do you connect with all your patients on a level that you can give them comfort and take good care of them?
So after I'm done assessing my patient, like I said, I don't get too personal, but I always ask them, like, how do you like to be called? Do you have any children, any family? What kind of work did you do? And just try to really make a connection with them, make them feel like they're not just sick, they're not just laying there. And I treat my patients like they were my family, like my own. And I think that makes a lot of them feel really comfortable, because a lot of people think they come to the hospital, they're sick, and you know they have to go to rehab or just go home and come back again. And I'm not just try to connect with them where I don't want to say we're in the same level, but where where I understand them, and I think that's something that really plays a big part. Because I never personally been sick in a hospital where I need somebody to care for me, but I know how I would, what I would want or how I would like to feel. And of course, the nurse is the one that's always communicating, the advocator. So I feel like it's important to listen to the patient and then bring it to the team.
Well, that's an amazing and wonderful description. And you know, the patients who are cared for by you are very lucky.
Thank you.
That's very obvious, and it was very obvious in the story that the patient wrote about you. So, you know, on behalf of all of us, thank you. We're very grateful for you. We're happy you're with us, and hopefully you'll spend your whole career here.
Yes.
So thank you for all you do.
Thank you.